Hi, my name is Enrique Rangel, and I'm the CEO and founder of MyMedLeads.com, a lead management system used by medical practices worldwide. Today, I want to talk about why doctors need lead management. Number one, doctors do different types of advertising, whether it be offline advertising, such as yellow pages, print ads, TV, and radio, but they also do a lot of online advertising. Then there's paid directories, pay-per-click through AdWords, social media such as Twitter, Facebook, and blogs, and so on. And it's important for doctors to really know what's happening when the leads are coming in. They want to know that their staff is not only doing what they're supposed to, but that they're following up with these leads that they're producing through their many sources. We also see that it's very common for a practice to get a lot of callers, a lot of inquiries, but not everybody schedules a consultation. And in some of the tests that we've run, we've seen that only 1 out of every 14 callers is actually calling to schedule. If you're a dentist, it's common for patients to call in or prospects to call in and ask for pricing for teeth whitening. Or if you're a plastic surgeon, they're going to call in and ask questions about the cost of a certain procedure or if you take insurance. And I think that there's a lot of doctors that are missing out on opportunities here because it's important that when somebody calls that you're capturing their information. If you're only scheduling 1 out of every 14 calls, what's happening to the other 13? Also, we see that a lot of the leads that are coming in are not being followed up on. So basically, a lead comes in, your staff calls it one time, and then you might leave a message, and that's the last time you call the prospect. You're not going to be successful or effective if you're not following up with the leads. We also want to make sure that whenever somebody goes to your site and fills out a form, that those leads are being called within minutes and not hours. In a minute, I'm going to show a study that shows that if you call a lead within 5 minutes versus 35 minutes, your chances of turning that lead into a patient are 100 times greater. And the problem isn't really that your staff doesn't know what they're doing. It has to do with the fact that they probably have to multitask and they have a lot of things on their plate. So it's really hard for them to be able to keep track of everything that they're supposed to do. And without having a system that does it for them, it's virtually impossible. So really what it all comes down to is that a practice will be throwing money at advertising. You'll be trying different things such as billboards and print ads, yellow pages and pay-per-click, but you don't really know what's working. There's no clear and simple way of really tracking ROI on everything because first of all, when your staff asks somebody, how did you hear about us? Most of the time, the information that they're getting from that prospect is not correct. It's very common for people to say, oh, I found you on Google. Well, that doesn't really give you a lot of information. How is it that they got there? Our system will capture 100% of leads, and it'll also be able to track ROI on each lead. So I'm going to get started to show you how easy it is to sign up to MyMedLeads, and once you're signed up to MyMedLeads, some of the things that your staff will be able to do, and ultimately what the reports will look like that will give you the numbers that you need. So one of the first things we do is that we want to be able to get a list of all of your different lead sources. If you're heavy on the web, you might have a lot of paid directories. You might just be doing a lot of print ads. You might have a mixture of everything. Well, everything has a cost, and we want to know those costs because later we're going to be able to turn that into an ROI report for you. So once we capture that information, we are able to get the forms on your website talking to our site, which is very, very simple for your webmaster to do, or we can even help you on it. So on form submissions, like I said before, the first thing we want to do is that we want to integrate with the site. We also can integrate with services such as ReachLocal or Google AdWords. That way, whenever a lead arrives from any of those lead sources, we'll know where it came from. And then we put a stopwatch to every lead. So every time that a lead arrives, we want to be able to know how long it's taking your staff to call that lead. As you can see from this, let's say that this was the form on your site. A lead gets placed. It goes right into our platform. We'll send an email to your staff that looks somewhat like this. And this email will have no contact information. What we want to do is we want to be able to track what's happening to that lead once it's called. So we send an email like this. It says, please click here. When you click here, it logs them right into our system. And it'll track when the lead gets called because we put a call now button. When you click on that call now button, it actually will auto dial for your practice. So this is the best way to be able to not only know the quality of the calls that are going out because we're recording every call, but it also lets us know how many times the lead has been called and what the next action steps would be. So from this lead management tool, as you can see at the bottom, you get to see the history of every lead. There's a section in the middle of the page that if it's a Spanish-speaking prospect, you can actually click on that. And later, whenever we send out email campaigns, they'll go out in Spanish. Now, not everybody that comes to you is coming through a form inquiry. The most common way is people just picking up the phone and calling. So what we did is we built a tracking system that allows you to capture 100% of callers. What's good about this is that your staff no longer has to ask, how did you hear about us? Because we'll always know where the leads came from. Basically, we give you a phone number to put on every single lead source so that if anybody calls any of those numbers, we're going to be able to know which part of your advertising is working. We want to make sure that your staff is calling leads fast. So I want to talk about automated email marketing for a second. It's important that you stay in contact with the prospects that are calling in. So let's say that somebody calls or fills out a form, but they don't schedule a consultation. Maybe they had a question about a certain procedure or pricing or how fast they would be back at work. You want to make sure that you're in front of those patients and that you're talking to them. And the way we're able to do that is through automated email marketing. So the system works like this. So basically, if a prospect has requested information about liposuction, we want to be able to send them a series of emails. Email number 1 can go out 24 hours later. It can introduce your practice. Email number 2 it can go out 3 days later and show some before and after photos. Email number 3 can go out, let's say, a week later with some more information, maybe a link to a video. And then email 4 can go out a few weeks later with a gift certificate for liposuction because that's what the patient was asking for. So in essence, all of these email campaigns are going out automatically. They can go out in English or Spanish, and they will stop going out the moment that the patient schedules. Just as important as email campaigns, we want to make sure that your staff is calling leads over and over. And we have a system for it so that your staff doesn't have to figure out who to call. Basically, once a week we create what's called the follow-up report. And the follow-up report gives a long list of patients that haven't scheduled yet, but your staff needs to call again. We typically like to tell practices that if you call leads 4 times, you're going to get a lot of those people scheduling, usually by that 4th call. So in fact, we've seen practices that increased by 300 or 400% of their conversion rate just by simply calling leads back. The solution to getting more business is not to spend more on advertising, but rather to become better at managing the leads you already have. And finally, the reports. It all comes down to reports. We want you to have an easy way for you to compare apples to apples. You want to have all of your leads coming to one place. It's important that you know what your return on investment or ROI is. You need to know how much money you're spending and how much money you're making from every single source of advertising. And you also want to be able to compare your staff's performance and quality of the calls. Because our system is now recording all incoming and outgoing calls, you can very easily from an iPad, from an iPhone, from anywhere, just go and listen to a couple of calls to make sure that the quality's up there. It comes in really handy when you hire somebody new and they're in the middle of training. You can go back and you can have a few calls that you want them to listen to so they can know what they're supposed to sound like and also what they're not supposed to sound like. And after you've been using our system for a couple of months, it really helps you take a look at your marketing venues and determine which ones are working and which ones you need to cut out. So you can make educated decisions and you're able to cut a lot of your advertising expense. So this is just one example of a report. This report was done for a client that is using ReachLocal as a lead source. ReachLocal is a pay-per-click management company that has clients all over the country, not just doctors, but in different industries. And in this case, you're able to see how many leads came in for the month and also how many leads have come in year to date. And the way that they distribute leads is through web submissions, emails, and phone calls. So our system is going to be able to track everything that's happening, all the leads that are coming in, and it'll tell you how many of those leads have turned into a paying patient. On the right side, you're going to be able to see how your staff managed those leads when they came in. It's important to know that leads have to be called quickly, so you're going to be able to see the response time. And it'll also show you how many times or how many attempts there have been for those leads that came in from ReachLocal. So you can run a report like this on any lead source. You can run it on an aggregate level so you can see your final reports. And here is just a few clients that have been using our software that have seen amazing gains. In just 60 days, the average medical practice that joins our system sees a 132% increase in conversion rates. And this isn't even counting how much money they were able to save from cutting out advertising that wasn't working for them. Ultimately, the main report that we have is an ROI report. And the ROI report makes it very simple for you to see how much money you spent on advertising for a quarter or for a year and how much revenue came in from that. There can't be a better report because this report will basically show you in dollars and cents to the penny how much money you're making off every single advertising source. So to recap, this is our platform that allows you to track any lead source. It allows you to track the response time of every lead. It'll send out text message reminders to your patients. It comes with call tracking so that you can record incoming and outgoing calls. The system will automatically send out automated email campaigns. It'll help you eliminate no-shows. It'll help you get more patient reviews, which is key right now. It'll give you the reports that you need to track your ROI. And ultimately, it'll get you more referrals from the patients that you already have. As you can see, MyMedLeads is an indispensable tool for any medical practice. And we encourage you to come to the site, which is mymedleads.com. In order to sign up, you can either click on the register now, or you can just go to pricing, and it'll show you the two different packages that we offer. So just give us a call if you have any questions. We can be reached at area code 512-301-9715, or you can reach us at our toll-free number at 877-701-6337. Thank you.